Hello and welcome to DIY Therapy. As always, we'll start with our disclaimer. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. My name is Will. With me, as always, is Andy.
What's up, Will?
We're in the same room together now.
I know. Actually, it's kind of nice. We've, for those of you that don't know, we've been doing a lot of podcasts because of our schedules and different places using Skype, and we can still see like video of each other, but it just
not the same.
It's not the same. No, it's certainly not the same. And there's a delay in the video.
It's harder for me to interrupt.
You mean my rambling?
Just interrupt. Period.
Oh, all right. Well, now you'll do phenomenal at it. So,
how you doing?
I'm doing well. A lot of snow. We're in the Midwest here, so we've had a lot of snow and a lot of school closings. In fact, what is your name again? Will. Will's little boy is here, so if someone comes jumping in at some point, we might have a guest star. Yeah. So, it's just been busy with the school closings and everything like that. Yeah. So, how about you? How have you been?
Same thing, just shoveling and dealing with kids being off of school and trying to work around that.
That's hard, isn't it? Like juggling little kids?
I mean, depending on how the size weight is. I mean, Henry is really hard because he's just so heavy. Harper's easy; she's light as a feather. And Nora is just gangly.
You are an idiot. You are an idiot.
I was going to ask you about we're talking about that cookbook for back pain.
Yes, the cookbook.
And I was going to ask you, do you think, because the spine is a fairly complicated thing, that people would be able to treat themselves because if it's overly complicated, that they would be able to understand the concepts of it?
Yeah,
I mean, daunting.
That's a really good question. And just a sidebar here, real quick. We're going to be rebranding the book to be a DIY therapy product. So eventually, we're going to have a name change here, but it is still considered right now the Rehab Cookbook. But that's a really good question. Yeah, I mean, the low back is complicated. Just a couple statistics off the top of my head here. About 85% of all low back pain is considered ambiguous, meaning that there isn't a specific diagnosis, even when you're going through medical, the whole medical process, that we can't contribute it to one single problem that's in the spine. And so it can be daunting for a lot of different reasons. One, because what is the underlying cause, and then patients and individuals simply have a fear of, okay, well, am I going to harm myself by doing different things and not getting a true diagnosis or true medical evaluation from a professional. But I think the reason why we wrote the book, or I wrote the book, was because of the alarming need and desire for people to figure out what is wrong with their back. And so there's a focus, I think, for many people of trying to figure out what is the diagnosis of it. Well, that's all great and that's all grand, but a lot of times that can actually lead to bigger fears.
People become their diagnosis.
People become their diagnosis. They read up. Google MD is just a travesty right now. You read something. I always joke around. I'll Google something for symptoms for my kids, and all of a sudden they have a death sentence. I'm like, oh my gosh, we're going to be burying my kids the next day, because they have all these symptoms. So it can be very fear. It can drive a lot of fear. But so there's this underlying desire for people to figure out what's wrong, and I think the bigger question that people need to ask themselves is not what is wrong, but why am I having pain?
Yeah.
Okay. And so if 85% of individuals really don't have a diagnosis, okay, or it's multiple things going on, then really it's not about the diagnosis. And that's a perception that I try to change with almost every patient that walks through the clinic doors that I treat, is that people are very focused on this diagnosis. Okay, well, that's great, but what is it that you're doing in your daily activities that are really driving that pain? So, it's a shift in terms of thought process of, okay, what is the problem, but versus what am I really doing, or what is the activities that are really bringing on the symptoms? And that's where this process that we've kind of developed, and that I use in the clinic, and that we've written out in this cookbook, is really, I think, quite to be honest, I think it is simple once you break it down. Okay, and so when you break it down, it's really just about identifying simple activities that are driving your symptoms. So you take a look at your pain throughout the day and you monitor it, and you say, okay, well, I was having more pain around noon. Okay, well, what was I doing? Okay, oh, I was sitting. Okay, so now I'm sitting. Okay, so what position is my spine in when I'm sitting? Oh, it's flexed. Okay, so maybe that's a bad position for me. So then you look at other times throughout the day and you say, wow, there's a pattern here. Every time I'm bent forward a little bit more, every time my spine is flexed a little bit more, I'm feeling a little worse. Okay, and then in this specific example, if you take a look at, most likely the opposite would be true, is every time my spine is more upright, more erect, more back bent, in a back bent position, then my symptoms actually feel better. So you start tying, the moments throughout your day with whatever activities you're doing, and then tie that and correlate that to a spinal position, and then you've essentially figured out what the pattern of your symptoms are. And then over a period of time, if you just continue to follow that pattern, do more of the good activities, the good movement patterns for the spine, and in that example, extension, bending backwards would be good for you, and bending forward, flexing forward would be, probably a position that's worse for you. So it's really not that difficult. It's just understanding that we play the role in our symptoms, not our diagnosis.
Yeah.
And if you can understand that process, then 85% of those individuals who have ambiguous pain, don't have a specific diagnosis, you can sort through your symptoms, and if you're consistent with your activities, then you can actually lessen those symptoms. In fact, only 3 to 5% of all patients with low back pain are truly people who it's recommended for surgery or other types of aggressive interventions such as injections and things like that. So it's really not more serious or aggressive types of interventions such as surgery and injections are not really recommended with the majority of back pain people. So you've got to learn how to treat yourself.
Yeah.
I look at it as more of a necessity, not is it too complicated to do it? I think if you're going to manage your symptoms, you absolutely have to. And a perfect example is a patient that I actually saw yesterday, where he had been given the runaround several different times by he'd been to therapy before in the past, he'd been to different medical doctors, been to a chiropractor, and everybody just was diagnosing him. Everybody was just doing lots of passive treatments, in other words, just things to him. And I sat down and I spent 45 minutes with him, taking him through this process, and he was blown away by the different style of treatment, and that now he had an opportunity to really assess his symptoms in a different way, knowing what he needs to look for, knowing what is good and bad in the symptom pattern, and essentially he walked out of there feeling high as a kite, thinking that he could have a really good positive impact on his pain. And that's what this book is designed for. It's to basically duplicate our therapy sessions. You practice the same thing, Will.
Yep.
And so it's really designed to duplicate this to the masses and give people an opportunity to treat themselves, to assess themselves. So yes, it is complicated. But it is a process, and that's what we're teaching you. And if you follow the process, you can certainly go through and make a big difference in your pain.
Yeah, I think that's right.
Glad you think so. Any comments, Will?
Not necessarily, but I was going to add that people become their diagnoses real quick.
Real quick.
As soon as somebody has gotten an MRI or something like that, they are like, oh my God, I have a bulging disc. Therefore, I'm broken. I can no longer do these things because this thing is causing me the pain. It has to be. Whereas it may not be. It might be, but it may not be. It's just it's something that
Yeah. Our preconceived thoughts on our pain walking into a clinic or a treatment are really important. They have huge impacts on our outcomes, and that's what we want to try to change. And that's what I think this book can give people is a chance to kind of reevaluate how they're looking at their symptoms. Perfect example of this is a patient I had last week who came in, and he was all distraught because of an X-ray that he had. And the X-ray that he had actually said there was a congenital
Explain what that is.
Okay, so congenital is something that is basically a birth defect. It's something that has that's been there their entire life, and he was so concerned that there was this congenital dysfunction that showed up in the X-ray, and I explained to him that this has nothing to do with the congenital problem. You've heard words now that are very scary. You're focused on the X-ray, and that congenital defect has been there your entire life. The guy was 43 years old, and it had nothing to do with his actual. There was no correlation to how he presented to the clinic, but he was so fixated on this congenital deformity.
Well, it's not new, but it was new to him.
New to him, exactly, and that's the power that like an X-ray or MRI finding.
Power the suggestion in a lot of ways.
Yeah,
it's almost like hypnosis in a lot of ways.
Just the words.
Yeah.
Just the words. Our words, the words that we as medical professionals use are very, very alarming sometimes to the layman. Okay, and so it's one of these things that I know you are, and I know I practice this too. I'm very careful with how I describe people's pain.
Yeah.
Because we want to set you up for success in terms of how we talk about things and let you know that the medical terminology is scary sometimes, but it really isn't. It's not as scary as it sounds.
Yeah.
Yeah, and it's most likely the real reason you're having issues is because of, again, it's activity driven, things that you're doing on a regular basis.
Generally, yeah.
So.
Well, that answers that for right now. Do you want to bust some myths?
Mythbusters.
Can we blow something up?
That's what they do, isn't it?
After every episode, yes. The whole goal of Mythbusters is basically just to blow something up.
I don't think I've watched that in about 10 years. Is it even still on?
No.
No?
No.
Okay. I liked it, though.
They kind of, the three kind of side characters or little helpers, whatever they are, they had a show on Netflix.
Oh, really?
So, like, I can't, Imahara and the girl and the other guy, I cannot remember their names.
You remember Imahara?
Yeah, I don't know why.
You didn't remember?
Grant Imahara, because I don't know why. Probably because he was funny to watch because he was so motion sickness. Did you ever see that episode?
No, I didn't.
Okay, so I forget what they were testing, like how to motion sickness cures or something like that. And there is you can build it at home. It's not overly complicated. So basically, it's a chair it's on a Lazy Susan, so it's just spinning.
Mm-hmm.
And there's 4 tennis balls on. They're like right above your head to the front, to the side, to the back, and basically, while you're spinning, somebody will just say, okay, touch the left one. And you lean over, touch the tennis ball to the left one. And then somebody will just say, they'll just constantly moving your head around in space whilst you're spinning, too. And some, 2 of them kind of got sort of sick.
Uh-huh.
He got sick immediately, and it was violent, and it was pretty funny.
Why do we love seeing that kind of stuff? My favorite episode
it's human suffering. Especially where it's not like
true human suffering. It's short term.
Yeah, what are always the funniest America's Fun at Home videos? The dad getting hit in the testicles by the kid.
Yeah.
Every single time.
Yeah. My favorite episodes with the Mythbusters was always when they would do something involving drinking, because none of them were drinkers.
No,
so they would just get ripped very quickly.
Very quickly.
It did not take much, and they just all of a sudden things were just coming out of their mouths.
Yeah.
Typically, so those were always my favorite ones. All right, so Mythbusters. Sidebar.
Do you have any?
I think one thing that I always hear is patients will come in and say, "Well, I'm really tight, so I have pain."
Tight like muscles?
My
back is tight?
I don't know. I'm really tight, so I have pain. So I think most of the time they're referring to muscles. Yeah. Yeah.
Usually it's low back. I'm so tight back there, we massage it.
Yeah.
Like that's gonna solve.
Or my hamstrings are so tight that I have pain.
Yeah.
Or I've got a shoulder issue and I'm tight. And I don't stretch enough, so therefore I have pain.
Yeah.
Yeah. That's probably more of what we hear.
Right.
Yeah. So just in general, not stretching. There's no correlation between specifically tight muscles and not stretching.
Right.
Yeah. I think that's something that is. There's this perception that after we have an injury that all of a sudden we are tight, and that's usually a tonal change just from the brain's the brain's desire
to
protect the joint.
Basically, it's using your muscles to act like a shield, like a splint kind of thing.
Yeah. Low back pain, a lot of times you don't see people doing rotation or anything like that. You see them kind of moving in a very segmented position. It feels almost, people will say like, hey, it feels like I've got a corset around my waist, things like that.
Corset? Corset.
Corset. What did I say?
You said a corset.
So what's a corset?
Well, it's the thing. I don't know. You just said it funny.
Oh.
You're right.
Tomato?
Yeah, basically.
Okay. Yeah. There's no correlation to that. Just because you're tight afterwards didn't mean that you weren't stretching enough prior. Okay. Again.
Yeah. Causation is correlation. All that.
Yeah. There's no correlation to that. So that probably needs to be busted a little bit, and that thought process is wrong. The other thing then is that many people, when they have that idea in their head that they need to stretch more, then they start to stretch after their injury, but they're not doing it properly,
right?
And therefore, then they are actually
feeding it.
They're feeding it into this process, and at that point in time, they're now making their problems worse.
Yep.
Worse.
Worser?
You just went.
Worsest?
Yeah. There it is.
Yeah.
What else was there? We were going to talk about one other thing.
There was one other one that I've had to dispel a number of times, especially usually concerning like knees or hips, like the arthritis, that they're more prone to injury. That they think they're basically they get the diagnosis that they're bone on bone, and they think that basically they're one step away from becoming a vampire during the light and busting into dust and just falling apart.
Worst analogy ever.
What are you talking about? Vampires turn into dust, don't they, when you kill them?
I don't know. I think so.
They did on Buffy.
Buffy the Vampire Slayer.
Yeah.
Oh. Man. The original movie?
I don't know about the movie, but the TV show, yes.
That one we watched a lot.
Yeah.
And I think this also goes to, you can comment on this maybe, I think this also goes to the fact that I think many doctors, again, want to put a diagnosis on things, and therefore they do an x-ray and they're like, oh, there's some arthritic changes going on there. So they just label it as this blanket diagnosis. And so
just, move on.
Yeah, and therefore people are
don't explain.
Yeah, that's exactly it.
And, they understand it, but they don't maybe have the time to. And also, you may be sitting in the doctor's office and the doctor comes in and he reads it off to you, and your brain is already reeling and you don't have time to think about the questions. Mm-hmm. So you just leave him and then your brain just sits on it and stews on it, and you're like, oh no.
Yeah, and it's a cop out. In my opinion, it's a cop out diagnosis because everybody has arthritis over the age of 25. Okay, and so it's all varying degree. Now, if you have the spine of a 95-year-old at the age of 35, there's probably some correlation to your pain, and maybe you do need to be monitoring your activities a little bit differently and things like that. But that is not the vast majority. That's a very, 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 very small population that actually occurs in. And so to kind of go back on what you're saying, you are, for the most part, as long as you're having fairly normal arthritic changes for your age bracket, you're not any more fragile than anybody else.
No.
Again, there are exceptions to the rules, but not the number is much smaller than of those exceptions, and what it's most likely not you. Yeah,
you're not one false step away from breaking your knees or your hip or whatever you have arthritis in. You're fine. It's still as strong as it was before. It's just sometimes it just might hurt more because of the arthritis, but it's not fragile.
Yeah, and it doesn't mean that you don't have to monitor your activity in some capacity and modify different things and the way you do stuff, but you're not going to take one step and your knee fall out.
Flat tire.
Just
blow out and blow.
Yeah. So that's a fallacy.
Yeah.
Yeah. So, anything else?
I was going to tell you that I saw something, but I can't remember what it was. I mean, I know I told you I'd seen Justice League and I had major problems with it.
Actually, Will and I went to Aquaman.
Yes, we saw Aquaman together.
Did we? Was this
a couple weeks ago?
Have we been on a podcast since then?
No.
Stay away from doors. That's all I've got to say.
Yeah.
Stay away from doors.
Anytime you're next to a door or a wall and you're having
a casual conversation.
Yes, where you're explaining your character motivation to another character.
Boom!
There will be an explosion.
Has to be. And then the whole wall falls apart.
Yes, and sometimes it's not necessarily near a wall. So, I mean, just be careful anytime you're having any sort of like dialogue where you're explaining your feelings or motivations with somebody.
Boom!
There will be an explosion.
Yeah. Actually, the whole we were talking about this off the podcast prior to the podcast, but the movie itself was like I was entertained through the whole thing, but the dialogue
was bad. A lot of times it didn't seem
not good.
No,
I wouldn't say it was bad. It was
sometimes people didn't seem like they're having conversations. Like somebody would say something and then somebody else would just say something after them where it seemed like they should have been listening to him and responding to it, but they just said something completely different.
I'm surprised. Like you and I again have talked about this. I am fine with just being entertained and being tons of plot holes and things like that, as long as it's entertaining and for the most part the acting's fairly good. I'm surprised that, and this was borderline that for me. I'm surprised it actually got as good of reviews as it has, and it's done.
It's got to be getting graded on a scale compared to Justice League and the like.
Well, yeah, comparably, it's an A+ compared to Justice League.
It looked good.
Oh yeah, visually it was fantastic. Yeah, the special effects were amazing. But yeah, it was entertaining. It was entertaining.
It was a wild ride.
Yeah.
There's a lot of interesting, weird things that were happening, and I don't entirely know why. I mean, I do know why, but why?
I would have liked to have seen a Wonder Woman cameo. I don't know why. I just would have liked to have seen it. Kind of continue to just pull those things in.
I think they're moving away from that. They're moving.
But they're keeping Wonder Woman, right?
Yeah, they're keeping all the characters, but they're moving away from like the interconnectivity of everything.
They're trying to actually pull away from it. Not doing the Marvel thing.
Yeah, I think that. Yeah. Why don't you just make good movies first, and then worry about building a universe second?
Yeah.
But what do we know?
Big problem. I don't know. We don't know anything.
No. Other than that, let's wrap this up. This podcast was for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. Remember, treat yourself.